we have begun. This is a couple of things. This is the unit we're starting today. I'll probably get started with the neurotransmitters. It's kind of what I had written up on the board up there, but I'll go over and reiterate it when the time comes. And so that's really this is the important part. And what really surprised me positively is I have very, very little experience with artificial intelligence. And I was shocked. One of the students from a different class of our, well, I have 4 sections, all the sections, had basically, and I'm encouraging you to do this. That's why I'm sharing with it would be wrong for me not to share it with everybody. Is that individual took that recording that I do, that verbal recording, and basically put it into Chat GTP and said, listen to this and make up an exam. I almost fell over. When it's do that, please. It's like, I mean, it's apparently I was fairly clear. It must have looked into heard from that recording and figured out exactly what I was talking from, because if you had that alone, you would certainly do well on the test. So do me a favor, do that. Look, I'm going to tell you this. In other courses where it's about intellectual product, and meaning if you're going to be writing a report and trying to do that, there's just too many programs that can determine, they're going to look for literature citation, proper acknowledgement, the use of intellectual property. You can get into trouble doing that in courses. For me, I could care less. All I want you to do is get the answer right. But there's a person in whatever field you're going to go into with maybe a very, very, who's going to care a whit about 3 sodiums going in and 2 potassiums going out of the motor end plate. They could care less. No patient, if you're going to patient, will ever ask you that. I promise you. Unfortunately, it's part of the curriculum and you got to know it. The test of getting this for a lot of the fields is being able to assimilate complicated information and basically be able to respond to it in an examination to a reasonable degree, to what we would consider a passing degree. Got it? That's why we got to do this stuff. Trust me, in real life, nobody's going to ask you. Nobody cares. I just want you to find the easiest way to study for it and get it right. So please, feel free to do that anytime. I mean, I don't. Maybe other of your instructors will be concerned. For those of you, the nearly 50 of you, who for some reason want me to teach you microbiology, do the same darn thing. Because it's harder. Not you two. Stop laughing. My wife will think I'm actually funny. Oh yeah, she's like even yesterday. Lou, would you get your head out of your, well, you get the idea. She actually let me drive her car, which is very unusual. She says I can't avoid going over curbs, and we had to get a new tire. So she is just like, okay, you can drive my car today because you can drop me off when we're shopping because of the cold and the wind. That was the only reason. Good Lord. All right. So that's the commentary that's there. Today's topic for today, everybody, is how the nervous system actually works. And so we're going to examine first the synapse and really what's transmitted or sent across the synapse. And our focus point is chemical. You're going to see it's not the only type. There are a synapse is a connection between a nerve and another nerve, or a nerve in a gland, or a nerve in the muscle. We studied the one in the muscle. This is going to reinforce what happens. And the neuromuscular junction is just another synapse. It's a tiny space that's filled with fluid, so tiny, but literally thousands, if not millions of molecules are swimming around in there. Molecules are really, I mean, we're talking atomic sized, just to get the idea that even though it's a tiny space for us to think about, the reality when you're starting to think about all those things on the periodic table, when you get into those kind of molecular measurements, there's a whole bunch of them that are. So the nervous system works as information flows from nerve to nerve. Nerves are functionally connected by synapses or synapses. It doesn't matter what the word is. I know you guys are always here, so you came in a little bit late. let me just reiterate to you the point, because I don't want to count out people who are always showing up, honestly, because a lot of people won't listen to this if they're not here regularly. Again, I had take that review recording I did, get on an AI site like ChatGPT, tell them to make up an exam. I had a student who showed me this in another class. It was my exam. Maybe not the same questions, but Lord knows the same answers. Okay? Do that. I don't know. That's the only AI site I know is ChatGPT. I should know more about it. My son is, pardon me, while I stretch and pat myself on the back for having a very successful kid, is the Navy surface, the entire surface warfare of the U.S. Navy. He is the one responsible for pointing them how they can effectively use artificial intelligence. So in the span of about 6 months, he had to become an expert, among his other talents, of being very annoying when it comes to talking to his dad. It usually starts with, "I was really tired today." And he goes, "Yeah, you're old, Dad. I'm tired." That kind of loving relationship. Sorry. The nervous system works at those synapses, one nerve to another or one nerve to a cell. I'll try not to use this terminology, but this is useful terminology. A lot of the exams, if I say presynaptic and postsynaptic, you can come and ask me what the heck I'm talking about. Other people won't do that. But these are terms that you see, and when we get to the autonomic nervous system, you're going to hear about preganglionic and postganglionic. That's part of the course. It's part of the nomenclature that you're stuck with. Presynaptic means the transmitting end. Postsynaptic is the receiving end. Postsynaptic doesn't have to be a nerve, like you say, it can be a muscle or a gland. And most nerves are receiving information from a lot of sources, processing it, and sending it to a lot of other sources. Mostly what they do, that vast amount of what we call in-between nerves. The synapse we're focusing on is this one, axodendritic. This is the one, even though you can't see it here, you'll see it differently shortly. The axodendritic is typically the one that releases those chemicals that we will come to know as neurotransmitters. That's where the focus point is. They are the most common. So in blue is the axon, this yellowish color is the dendrite. You can't see the synapse here. Schematically, it is where chemicals are being released. Sometimes it'll go right to the cell body. That's the next most common one. They say axo, and its names I'm never going to ask you. These ones are basically altering the cell body, basically saying, remember that signal you just got? Keep it in your hip pocket. Remember it, but it's not important to react to it. Those kind of messages. They're modifying the message. And even ones that go here, going to the axon, are saying, you better get this information out in a hurry, or, you can take your time with this. This, you better send Federal Express overnight, and this, you can just put this in the mailbox. Okay, you get an idea? So we have different ways of conducting the signal. I'm trying to show you the complexity of the system. Our focus point is here. That kind of stuff. You can see there's so many of these things there, and this is a true micrograph. There is just a lot going on with the nervous system. It's this amazing way of processing information. It starts to develop, in roughly 5 weeks of gestation. There's something called the neural tube, and whether you do that in AP2 when you start talking about development. Did you guys have growth and development yet, or is that for? Yeah, I don't know how much they'll get into it. But again, I'm here. You can ask me questions as a resource. I'll be here. I promise you, next term and all of next year, Lord willing, that I'm healthy. After that, no more promises. My best by date might be. I know that I might force myself to come to your graduation, even if I have retired. I'll have to sit in the peanut gallery with all the moms and dads. Don't clap till everybody's done. Everybody's clapping. I went to so many of those. That same son, you know what created that problem? He goes, you didn't go to my college graduation. And I just looked at him and said, God's honest truth, I didn't go to my own. It wasn't that important. I went to your master's graduation. I went to your commission. I went to your promotion. I went to your change of command where you gave command of your destroyer to another individual. They celebrated your command. I didn't have to go to your college graduation and sit there and go, I know, sorry. I'm an old fuddy-duddy. Axodendritic, this is the one that we're going to look at. There are all sorts of them. Our focus is the chemical synapse. Yes, there are ones that are electric as well. You guys share that information with her too. I'm no fine for being late today. Because you're the people who show up and you're the people who need to get all this information. Most common type of synapse, the chemical synapse. This is the one we're looking at, neurotransmitters. The axon, and you've got this before. This is the same thing in that nerve going to the muscle. The axon has synaptic vesicles, it has mitochondria, and the receptor, in this case, it's on a nerve. It could be the motor end plate, but in this case, it's on the nerve. Okay? And yes, there's a cleft. And just the same thing as the neuromuscular junction. It's just not as complicated. It's fluid-filled area. The neuromuscular junction is a lot more complicated structure than nerve to nerve coming in contact with each other. And effectively, when I talk about the rate determining step, they use the same language here. It's why I can talk to my son in DC, okay, but it's going to take me 4 hours to drive there. So, I get on a plane, it was going to take me a certain amount of distance. When he was stationed out in San Diego, I could talk to him in San Diego. I could talk to him when he was stationed in Japan in real time. But I can't. Obviously I can't. I'd have to take 4 hours to fly, even in a jet, or however long it would take to go to Japan. But I didn't feel inclined to go there. That are here. So right in July, he and his whole family will be on Bahrain, an island in the Persian Gulf. Not going to visit. That's 2 years without seeing my grandchildren of that marriage. Right. So that's the idea of that. Even though it's a tiny space, it's what takes that signal that may seem massively fast to you at 200 meters or 100 meters per second, but really is not, compared to a true electrical connection that's there. But basically, it's the change. It goes from electrical to chemical and then back to electrical. Okay, so the synaptic cleft prevents the nerve impulses from directly passing. It's chemical. It depends on, as you will see, how much is released, how fast it comes across, how rapidly it binds to receptors. And the big deal about this is it's how much at one time and how long it stays in there to determine whether that nerve fires or not. That's coming. And ensures, and this is about unidirectionality. The signals are going from point A to point B, from point B to point C. The odd thing about the nervous system, okay, even though we have one-way signals that go in that fashion, is that unfortunately that system, we have nerves reabsorb chemicals. We talked about reuptake. We'll talk about it again. Nerves reprocess neurotransmitters. They make new passageways. They make new mitochondria. So there's passages that are constantly present that allow, and we saw this before, how that toxins, how viruses, how bacteria can get in there. That's the one when I wasn't here, I think I sent you that information. Listen to that. That's how polio as a disease can paralyze you. How tetanus as a disease can and will kill you. They use those pathways, even though the impulse goes this way, the signal goes one way, stuff can flow back and forth. I don't do this animation, and this is just reinforces what you already should know for Monday. The action potential arrives at the presynaptic neuron. Okay, extracellular calcium, voltage-gated calcium channel, same deal as a neuromuscular junction, and the calcium gets in from the extracellular fluid. It's just showing you that from there. And so here, the same thing you saw before. Here are the calcium channels. Here's the impulse. Here you have all the synaptic vesicles, and effectively they're going to induce them, that calcium, for them to exocytose and spit this out. And notice you just have receptors. We don't have that elaborate motor end plate, the elaborate nature of the neuromuscular junction, all that jazz. You don't have to know the name. You might see the name again. It's called synaptotagmin. That's the protein that allows that snaring to occur. That's what's kind of interfered with Botox. We talked about before, those snare proteins, they can't latch on and allow for exocytosis. It interferes with that. Again, I'm not going to ask you about that name at all. Okay, that's synaptotagmin, but it has a name, and down the road, somebody might ask you that name. I've always found that on like licensure exams, they're in love with names that can be somewhat obscure. So I'd be making a list of Dr. Stein's obscure names that I might see again. Like hepatitis B was big before hepatitis C. Now we have an immunization. Hepatitis B is still a worldwide problem. And it was called, they had the name for whatever was called, what the problem was called Australian antigen. I mean, we have a hepatitis B immunization. Nobody talks about it here. But I've heard tell that it was on like nursing exams. Don't ask me. I have a memory for these kinds of things. Fusion results in exocytosis of the neurotransmitter. The higher the frequency, the more it spits stuff out. Again, frequency equals amplitude. What you got to remember. So important. I'm just showing it to you there. Those illustrations don't do it for me. I'd have to blow them up really large. The neurotransmitter diffuses across, just like the motor end plate. And this way, and typically the difference now is significant. Acetylcholine is generally excitatory. There's a couple of areas where it's an oddball. Acetylcholine opens those channels. We've talked about this endlessly. The 3 sodiums go in, the 2 potassiums go out. Ligand or chemical gated channel. Effectively, it's telling the nerve to fire. At the motor end plate, again, if we have enough of that happening, we're going to reach threshold, that muscle fiber is going to fire. The binding of the neurotransmitter opens ion channels, except the motor end plate, we call them end plate potentials here. They're graded potentials. And understand the difference is now important. Binding causes the protein to change shape. Ions open. In this case, it can be either excitatory or inhibitory. Okay, and even some of the receptor proteins are also ion channels. Doesn't matter. But the big deal is this: excitatory or inhibitory. You're going to see the illustration. It says fire or don't fire. Thousands of nerves basically telling you, you're taking that test. A looks good. B looks really good. C's stupid. D's ridiculous. Uh-oh. And E doesn't make any sense. It's between A and B. That's all fire, don't fire. And so you're going to choose one. You know, at least at this point, you have basically now have an educated guess. Your odds of success are 50-50 rather than 1 out of 20, 1 out of 5, who say, if you don't know anything. In the old, if you don't know anything, pick a letter and use it. Every time, same letter. It's typically B or C. That's the most, B, C, or D for the 3 in the middle. That's test-taking strategy. You know, if there's, the first thing you want to ask when you take a test, is there any penalty for guessing? Right now, there is not. Years ago, with SATs and with licensure exams, I don't know about licensure exams, with certain exams that I had to take, like the MCAT admission test for medical school, there was a penalty for guessing. So be careful when you do educated guessing, not out guessing. See, there's all the test-taking strategies. I can tell you how many of your Scantrons I look at and you erase the right answer. Stop changing answers! You only change it if you misread it, okay, mismarked it, or somehow during the test it came upon you, and it does. The answer. We try not to give away the store. Every time I write a question, I was like, oh, this is the answer to number 5. But I can't help it. Stuff they don't teach you in high school. Okay. Neurotransmitter diffuses, opens those channels, excitatory, inhibitory. You're going to see what channels they are. And yeah, you get a graded potential, just like we discussed. And the same 3 things. This is on the test you're taking on Monday. Reuptake, degradation, breakdown, whatever you want to call it, and diffusion, the 3 ways. Okay, they don't all do all 3 ways. Acetylcholine is an example of all 3. because it diffuses away a little. That acetylcholinesterase, that's important again, degrades it, okay? And even though the acetic acid we can use elsewhere and it kind of goes away, we reuptake the choline and recycle it. Okay? Really important. You're going to see I have it written up there, and I'll get to that in a second. So here they're just showing you the ways. Be familiar with it. It's no different whether it's a neuromuscular junction. It just so happens there's only one neurotransmitter there. And yet, this is the idea, okay? This is when I talk about the rate determining step. This is extraordinarily fast. I mean, the delay is from 3.3 to 5 milliseconds. By no means is that a slow signal, but as again, when giving you the example of talking to somebody across the world in real time or being able to see them is a whole lot different. So and again, rate limiting step of the transmission, that's slowing it down is the area. That synapse, as you're going to see with these neurotransmitters, is how we interfere with it. I wrote the names up there. The three of the most common agents, they may use different ones, they all work the same way. Pharmaceutical companies just tinker with them based on their side effect package to make them more efficient. They rebrand them. They're about selling you product, believe me. Medicines have good, medicines have bad. You can't people have depression and OCD, eating disorders, bipolar disorders. It's more than medication. And it's medication, it's therapy, it's lifestyle changes. They're all involved in it. People are naive if they think a pill will change. It's not like taking an antibiotic for 10 days. You have protection. This is what we're talking about, these kinds of agents that are there. And this is where we impact by using neurotransmitters when we're dealing with psychological and psychiatric illnesses, when we're dealing with nervous system disorders that are not related to that. We attack neurotransmitters. We replicate them, we modify them. Principally what we do is we do what you can see up there called reuptake inhibition. We make more of them available at the synapse, and over time, that will either actually alter the receptors. And you're getting a short course. I mean, there isn't just one kind of receptor for serotonin, there's many. That's why there's so many different medicines that you, how many commercials, I know your students, and I'm a TV addict. How many commercials do you see where they're trying to sell medicines? And at the end, they have all those disclaimers. Don't take this if you've ever been allergic to the product, want to live more than a year after taking, somebody with a very quick talker. Okay? They want to sell you the product. Do you know what those meds cost? Oh my God. I was taking one called Cosentix, and then they put me on one called Humira. It's about $6,000 a shot. Somebody's paying for that. That's why medical insurance is so much. Real world stuff. Pharmaceutical is an industry like any business. It has the most important thing it has to do first is make money before it can help. It can help you, but they can't help you unless they can make money. The bottom line is, so that's the delay. Sorry to be preachy. Electrical synapses, these are different. Okay, it can go in either direction. Lots of different regions responsible for eye movements, how quickly we look around, hear something, see something, smell something, something catches your attention. And the hippocampus, which is involved in emotions and memory. What kind of memory is associated with the hippocampus, and what disease is usually accompanied by hippocampal changes? Did you learn about that? I heard you learned about the hippocampus, right? Part of what system? It's your emotional system. You're getting close. Limbic system. The limbic system. Damage, and we used to not be able to tell. What disease do elderly people get where they begin to deteriorate? Everybody knows this answer. My mom died of it. Yeah, what kind of dementia? Alzheimer's. Thank you. We just call SDAT, senile dementia of the Alzheimer's type. Okay, Alzheimer's typically is manifested first by loss of short-term memory. Where's that memory? The hippocampus. There's another area called the amygdala. That's the rage center. Smells trigger it. They're part of that limbic system. How much we like. I mean, I don't know about you. I love going into a bakery. Excited just getting close to there. My mouth starts to water. That's like if my kids would throw up, they're on their own. Because I'm sick to my stomach with that. I was the worst dad. No wonder they don't like me. I'm sick. I'm throwing up. Here's a plastic bag. Call me when you're done. And their mom's an RN with a BSN. She was the same way. I mean, they could poop all over the place. You can deal with it. But throw up? Ugh! The two of us were beyond ill. So understand, this is all part of this. This is how your brain develops when they talk about abundant and embryonic nervous tissue. And this is all about how they respond. It has to do with the amount of neurotransmitter and how long it's there. And again, they can be excitatory or inhibitory. Again, I'll tell you which they are. If I use the acronyms, I'll explain what they mean to you. Okay, and here's all it is. If they're excitatory, it's telling it to fire. If they're inhibitory, they're telling it don't fire. That's all it is. So typically when you open, like at the neuromuscular end plate, the neuromuscular junction rather, sodium in, potassium out, 3-2, greater influx of sodium, more than the efflux, and it causes it to be an excitatory potential. And if it reaches threshold, it'll spread. Axon hillock, trigger zone, voltage-gated sodium channels, blah, 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 blah. Just like we've talked about endlessly. We talked about it on Monday. It can be, but unlike the neuromuscular junction, it doesn't have to be going towards threshold. It can go away from it. They can open either potassium channels only, but more often they open chloride channels, and chloride moves in. We call those chloride-gated channels. That's how sedative hypnotics work. Muscle relaxers work. Valium, originally. Librium was the first one of those. Ativan, Xanax. Okay, names that you'll be sick and tired if you're going into a field with patients, because a bunch of them will be taking it. It works that way. It works through your neurotransmitters, and the chloride channels make it less likely to fire. That's inhibitory. Alcohol works that way. All of those are true. They take it farther away. They're a hyperpolarizing agent. And what do? We summate, just like they do at the neuromuscular junction. At the neuromuscular junction, if it stays there long enough, if you keep releasing more of the neurotransmitter, eventually it's going to spread past the motor end plate and start that reaction all over the muscle fiber. Okay, so EPSPs can summate and IPSPs can summate. Most nerves receive thousands of inputs. Okay, only if the EPSPs, the excitatory ones, will we make it to an action potential. And they summate over time and over an area. You can release a whole bunch in one area and get an action potential, or you can be there for a long period of time or constantly being re-stimulated. Finally going fire, 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 and bang over time. Or it can just be this massive output. Temporal means time, spatial means over a space. So one or more presynaptic nerves transmits in rapid fire. Again, more commonly, when we think of that, it sort of amplifies the idea of frequency reflects amplitude. And spatially, just a whole bunch activated simultaneously. And I don't get a lot of these. I don't get the rocking chair. It's okay. Just if those work for you, good. If they don't, no good. I'm fine. So I don't get a lot out of these, but if they help you, these little illustrations, good. This is what I wrote up there, synaptic potentiation. Okay, calcium concentration increases presynaptic terminal, more neurotransmitter, more EPSPs. Okay, so all of these are there. I mean, just by using the nerve more, we can play a role in it. Different enzymes are there. And what happens when we use it, this is the idea of use it or lose it. The more we use something, the more we learn how to use something, how we legal the system, and other thing is this, postsynaptic potentiation. This is the way most of these medicines that are used for all of those things, whether it's eating disorders, obsessive compulsive, which are all kind of the same category, mild depressive disorders, postpartum depression, not postpartum psychosis, not major depression or schizophrenia. There's a whole lot of theory. They basically work there. This is what they use now currently. Now, here's a selective serotonin reuptake. They inhibit the reuptake. That means more serotonin is available, and over time it alters the receptors. Again, there's different ones that are marketed because there are different receptors. There's serotonin receptor 5s and H5s and H12s, and you may learn about those in pharmacology. That's the intricacy of it. I mean, I'm getting sick and tired of seeing all these commercials about tardive dyskinesia. Has that been showing up on whatever you're watching, whatever we are watching it is? Oh my God. My daughter was on one called risperidol. She had bipolar 2. Okay, which is theoretically a milder form of bipolar. They put her on this medication called risperidol or risperidone, and she ended up with tardive dyskinesia. I mean, all of a sudden I forget what I was doing. I had to race home from the hospital or from my office. All of a sudden, her tongue was stuck out, couldn't go back in, her neck was cocked like that. That's called tardive dyskinesia. It's a side effect of these kinds of medicine. They're advertising a bunch of stuff for this. Some lady saying to her husband, your head and neck are moving and you're not controlling it. Oh, you better go take this expensive medicine. She was in the hospital for 3 days, and they actually had, it was a real concern. They had to give her some pretty serious medicine to make that stop. And it was just a major side effect of this medicine that ostensibly was supposed to be the best new thing for bipolar 2. Moving on. So what it does is it alters those nerves over time. So release of excitatory neurotransmitter is inhibited by another, and that means less is released, things like that, so you can stop it. It doesn't matter. And so, if you get some out of this, it's fine. We've seen all these gates before. I'm trying to make it simplified. I even told the other group, because I know Dr. Robbins gave you a lot of stuff on the brain. I was looking at the final exam last night, and I'm like, what have they learned already? I'm trying to make it less complex than more. So I don't want to be redundant, and I want my focus points to be on this chapter and on the chapter on the autonomic nervous system with some of the brain. I definitely have to do the spinal cord. So this is really the thrust of this PowerPoint, neurotransmitters. 50 or more, there's probably 10 we have to know. Okay, most nerves make more than one. So that nerve from your brain telling that muscle to fire can basically, it goes to, let's say it's going to the spinal cord and the spinal nerve, I want this muscle to move. No, I don't want this muscle to move. That nerve can produce 2 different neurotransmitters at least. Most nerves in your brain can, based on particularly frequency and electrical factors. There's more than one. It's not, the complexity is not there at the neuromuscular junction. That nerve going to the muscle can only release acetylcholine. So for instance, what happens in tetanus, okay, is the one that tells the muscle not to fire gets blocked, and every signal makes the muscle fire. So understand, we know how a lot of these things work. It doesn't mean we can prevent them. Polio, the only way we can prevent that particular viral disorder is through an immunization. It's everywhere. It comes from the water you drink. We talk about that in micro for those that are bold enough to put up with for anybody who has not had me before, if you see them there, you have to laugh at the bad jokes. Stupid analogies. Anybody new, don't tell them. It'll bother me. And different stimulation frequently, and we classify them. And thankfully, guess what? You already know everything you need to know about acetylcholine. It's the most abundant. When we get to the autonomic nervous system, 3 out of the 4 nerves use acetylcholine. So you already got it in the bank. It's the only one at the neuromuscular junction. It's used a ton in the brain, and most of them are excitatory. So first we classify them by their structure. This is unique because it's made from a common chemical in our body, acetic acid, okay, and choline, another common chemical. And you saw diffuses, breaks down, we reuse the acetic acid, we recycle or reuptake the choline. And don't forget how important this is, acetylcholinesterase. Please, you don't need this enzyme at all. But that one for this upcoming test and its implications, particularly with regard to chemical weapons and stuff like that, and nerve gases, that's what chemical weaponry is. They all inhibit this. That's a very big deal. So that's basically, you should know by now it's a test question. Please get it right. These are the next category. And this is kind of where, this will probably take the rest of me to understand. So serotonin is one of them. We'll get to. So you're going to see amino acid. You remember the structure. You don't have to know. I'm not going to ask the chemical structure. As an amine group on one side and an acid on the other side. In your body, when you ingest proteins, you have, let's say a hamburger meal. You have that the proteins from that hamburger, they're absorbed as amino acids. Your body typically lops off the amine group and then puts it back on if we need to use that as a building block to make more. That's how it typically works. However, what makes these guys biogenic amines, it lops off the acid group. That's what's left. This is one, remember we talked about essential amino acids. One of them is effectively tyrosine. It may not be the name that you see in a textbook, but effectively it's one of those, just like tryptophan. These are things that we have to ingest from diet. So we eat foods that are rich in tyrosine or that becomes tyrosine in your body. These are super important. Dopamine, you remember that substantia nigra in the brain and the midbrain, that dark, the black stuff, that's what it means. In the brain and the midbrain, is that ringing a bell? Okay. That produces dopamine and norepinephrine. It's implicated. The lack of dopamine is significantly implicated in Parkinson's. That's why they give them a precursor to dopamine to treat Parkinson's, even though that's been the major treatment for a very long period of time. Nevertheless, they used to think these were the cause of depression. Before we knew about serotonin for mild depression, eating disorders, obsessive compulsive, all the things I just talked about, they treated them by using these. They used a reuptake inhibitor, similar to what they do now with serotonin. Okay. And they used a reuptake inhibitor and they found that it didn't work. This was the early time. They had one called Elavil. So people were mildly depressed, it would elevate them. I actually utilized a lot of that for patients to deal with pain problem, chronic pain. It has implications in successful usage in that. Nevertheless, dopamine and norepinephrine are the classic catecholamines. Another name for norepinephrine is noradrenaline. Epinephrine, very, very similar compound, is made in your adrenal glands. That's where it gets the name adrenaline. So those names, people will either talk to you about adrenaline, science, and in medicine now we call it epinephrine. An EpiPen is an adrenaline pen. But the reason I'm telling you, when we get to the autonomic nervous system, they're named for acetylcholine. Some of the pathways are called cholinergics, and some of them are related to adrenaline. They're called adrenergics. And that's how you have to learn about them. For many of you who are going to take pharmacy or involved and having to be familiar with pharmaceutical agents. So dopamine, norepinephrine, and epinephrine are by name the catecholamines. We used to think they played a major role in depression. I'm sure some people still do. The trouble is there was a lot of side effects, which is usually the problem, from those agents. People who ingest foods that are overly rich in these, it would tend to make excitatory things happen. It might accelerate their pulse. They might become flushed, okay? They might have difficulty breathing. They might become agitated. That was one of the problems when some people would ingest foods that were overly rich in these substances that were there. I mean, you can look up what they are. I forget what they are off the top of my head. This is an enormous category. Indole is a chemical that is made as a breakdown product from these agents. Tryptophan is something that many of you are familiar with its effect. It tends serotonin is made from the amino acid tryptophan. Tryptophan famously is why the event that's coming up for many of us 2 weeks from tomorrow is what? Thanksgiving. What do we have on Thanksgiving? Do we have turkey? And with people, after a bunch of turkey at your house, right, they conk out. It probably has a lot to do with the turkey, and probably a fair amount to do with some of the beverages they're ingesting along with those turkeys. But a little red wine never hurt. I only use it for sauces. I make a dynamite pan sauce for steak with red wine, mushrooms. Delicious. Okay. So that's makes you sleepy. Okay. And serotonin now is a very interesting neurotransmitter. These guys are typically excitatory. Serotonin, it depends on the receptor. Like I said, there's more than one type of receptor for all of these. And we'll go over this again. And histamine, you've all heard of. Histamine is something that you're going to learn about in AP2 that are in special white blood cells called mast cells. Mast cells have these blue granules and they're filled with histamine. When they're released into the bloodstream, they dilate blood vessels rapidly, and blood and fluid extrudes out of them rapidly. If we have a cluster of them in the respiratory area, they also constrict bronchioles, your windpipes, the smaller ones. You get something called asthma. Sometimes it's an allergy. You can get something that's immediately life-threatening called anaphylactic shock. We have receptors for that elsewhere. We have them in your gut. If you know somebody who takes Pepcid, okay, or somebody who takes Tagamet, those are pills that block a special kind of histamine. They are actually an antihistamine that work effectively because it reduces the amount of stomach acidity. It causes your stomach and your digestive tract to be less active. And the one we're most familiar with are the respiratory ones. You have clusters of these mast cells, typically in your upper respiratory area, and basically for allergies and things like that to work with. There's all sorts of stuff that it's involved in. But histamine is also a neurotransmitter in the brain. When my daughter had that tardive dyskinesia, they gave her intravenous Benadryl. I mean, you can buy Benadryl over the counter right now. Okay, it's great for little kids, helping them sleep and things like that. Little capsules called diphenhydramine, generically cheap as anything you want to get. Little cough suppressant. They inject that into her intravenously. That's what settled down. That let her tongue go back in and her neck stop being like that. Imagine how scary it was. All widely used, play a role in emotional behavior. That comes from histidine, where it gets its name. So we're going to look at all of these, particularly as we explore more about these systems. So this is the introductory stuff. And lastly, this is where I ended it with the other group. I'll probably start here. Amino acids in themselves. Glutamic acid and aspartic acid. When any amino acid is dissolved in water, like it's dissolved in your bloodstream or in your digestive tract, we take away acid and we call it ate. Acetic acid is acetate. Aspartic acid is aspartate. Glutamic acid is glutamate. Okay. You'll see that. Read labels. You'll see things that are propionate and things like that. These are excitatory. The ones that are inhibitory and open those chloride channels are glycine and GABA. We always say GABA because it's such a pain in the neck to say gamma aminobutyric acid. Those are ones you'll be very familiar with. We will start there, and I'll reiterate this when we return on Friday. Thank you. Stop.